Hello everyone, this is Dr. Singaram, your pediatric faculty. So today I'll be discussing the questions which came in this AIIMS June 2020 exam in the section of pediatrics. Before I start the discussion, I hope that all of you are doing well and safe at this time and preparing well for your upcoming exams also. So we at Marrow are here to help you out with your preparation. You can post your queries in the Marrow Links Facebook group. We'll be replying to that at the earliest time possible. And through the discussion also we are reaching out to keep you updated with the new pattern questions in the exams. So let us start our discussion. The first question in pediatric section was, which of the following is not a symptom of severe dehydration? Now this dehydration topic is a very important topic which we keep telling in the classes, and as medical student you are expected to know completely the features of dehydration. You all know that dehydration is classified into no dehydration, some dehydration and severe dehydration. And this question is about severe dehydration, and the question is which is not a feature of severe dehydration. Okay, let us look at the options. Drowsy child is a feature of severe dehydration. Child is very lethargic, that's a feature. Pinched skin retracts slowly, that is also a feature of severe dehydration. Remember, some of the students may think that very slowly is a feature of severe dehydration. Yes, that is correct, but these are all relative terms, and you can take skin pinch is slow as a feature of severe dehydration as well. Now look at the next option, thirsty child. Remember, thirsty child is a feature of some dehydration. It is not a feature of severe dehydration, because in severe dehydration child will be very lethargic, and so thirstiness will not be a feature. Okay, so that's a very straightforward answer for this question. Answer is option C. Sunken fontanelle is also a feature of severe dehydration. So the answer is option C, which is thirsty child. Let's move on to the next question. The next question is about which of the following is not a criteria for severe acute malnutrition, or abbreviated as SAM. You all know that SAM is one of the emergencies in the topic of or in the disorders of malnutrition, which has been declared by WHO as an acute emergency. Okay, and that is why the criteria has been given by WHO, which includes 3 criteria. Okay, right. The question is about which is not a criteria for the SAM diagnosis. Okay, edema is a feature of SAM. It is actually bilateral pedal edema. Then you look at the next option, mid upper arm circumference less than 115 millimeters or 11.5 centimeters. That is also a feature of severe acute malnutrition. So the answer is going to be in either one of the 2 remaining options. Weight for height less than -3 or weight for age less than -3. Which is the criteria we are using? We are using weight for height less than -3 standard deviation as a criteria. So by eliminating the other options, the answer is option D. Weight for age is wrong. It is weight for height less than -3 standard deviation, which is a criteria for severe acute malnutrition. Please note that it is given by World Health Organization. Now for diagnosis of severe acute malnutrition, any one of this criteria is sufficient to make a diagnosis. We're able to understand this. So the answer is option D for this particular question. Let us move on to the next question. The next question is, surgery is done to correct VSD in an infant. Okay, right. Of course, ventricular septal defect is an anomaly, and surgery is the treatment for that particular condition in most of the cases. Now this will help in relieving, or surgery will help in relieving which of the following features? That was a question. Okay, right. It's actually a very straightforward question. If you don't correct VSD, and if it is a significant VSD, what is the complication the child is likely to end up with? What is the complication the child is likely to end up with? The child is likely to develop congestive cardiac failure. See, the moment an anomaly is not tolerated, the organ will undergo dysfunction, and for the heart it is congestive cardiac failure. I hope that you are able to follow this. Okay. Now, how does a congestive cardiac failure typically manifest in a child? It manifests like this: failure to thrive, hepatomegaly, and of course, in a small child, okay, you can have this breathing difficulty in the form of dyspnea, or in a very small child, it would be like feeding difficulties. Okay, right. So rather than the conventional features of congestive cardiac failure, in a small child, these would be the manifestation. Failure to thrive means child is not putting height and weight. Hepatomegaly, liver enlargement due to congestion. Then feeding difficulty, which is actually a part of this breathing difficulty. Okay, so the child is not able to feed properly. Okay, right. Okay, something equivalent to the exertional dyspnea. Okay, right. So answer for this question, yes, the answer is C, which is failure to thrive. Remember, arrhythmia can also be a complication, but the point to be remembered is that arrhythmia usually occurs as a post-surgical complication in these children. Okay, right. So heart block and respiratory alkalosis are very unlikely. Okay, and they are not the answer. So the answer for this particular question is failure to thrive or option C. Let's move on to the next question. Okay, the next question is child transfers an object from one hand to another. What does it imply? This is a question on developmental milestones. Now you can see the options which are given: ability to compare objects, ability to handle small objects, visual motor coordination, and voluntary release. Okay, this is a difficult question. Okay, it is straight taken from Nelson textbook of pediatrics, and it is not a usual question. Okay, right. So let us see what is given in Nelson textbook of pediatrics with reference to this question. I have already told you the answer. Answer is ability to compare objects. Now let's look at the content given in Nelson textbook of pediatrics. You can see here. Okay, you can see that the milestone and the developmental implications are being compared. You can see that grasping a rattle or a toy comes under usage of the object, and reaching for objects comes under visual motor coordination. Okay, takes the objects in the hands. Okay, by seeing it, that's called visual motor coordination. Then palmar grasp is gone. Okay, remember what they are talking about is an involuntary palmar grasp, which is a neonatal reflex. Okay, and that is actually like releasing the neonatal reflex. So this is also called release phenomenon. So now the question is transferring the object from one hand to another hand. You can see that it is coming under comparison of objects, and hence the answer for that previous question is ability to compare objects. Right. Let's move on to the next question. Okay, this is a very standard question and a very easy question to attempt. Phototherapy converts bilirubin to. You all know that we are going to use phototherapy in cases of increased indirect bilirubin. Okay, right. The problem of this indirect bilirubin is that it is water insoluble. So by giving phototherapy, you are converting this insoluble bilirubin into some form of soluble bilirubin so that it can be excreted outside. Okay, right. So how does this phototherapy convert this insoluble bilirubin into soluble bilirubin? It is by three important mechanisms. One is called structural isomerization, wherein phototherapy, by giving phototherapy, you are converting that bilirubin structure into another structure called as lumirubin. Can you see that? It is change in the structure called lumirubin. Now this lumirubin is a soluble form of bilirubin which will be excreted outside. So hence the answer for this particular question is option B, which is lumirubin. Okay. Just to mention the other base by which phototherapy acts is, one is photoisomerization, third is photooxidation. Question was about structural isomerization, and the answer for this question is lumirubin. Okay, option B. Right. So let us move on to the next question. Okay, the next question is vitamin deficiency that can lead to neonatal seizures. You can see the options: pyridoxine, riboflavin, pantothenic acid, and thiamine. Okay, right. Now generally, okay, when we talk about neonatal seizures, okay, we usually treat, okay, with phenobarbital. You all know that treatment of choice for neonatal seizures is, usual treatment is phenobarbital. That is the drug of choice. Okay, phenobarbital. Okay. Now, if it is not getting controlled, we go for other anticonvulsants. At the same time, remember, in a neonatal seizure, two important metabolic conditions always should come to our mind. Okay, right. What are the two important metabolic conditions? One is hypoglycemia. So that's why we always give a shot of dextrose to the babies who are having this seizures. Second is hypocalcemia. So two important metabolic conditions which should always come to our mind. Okay. However, in the question, okay, the options, okay, neither of these are given. Sugars are not given, calcium is not given. Instead, you have got some other options like pyridoxine, riboflavin, pantothenic acid, thiamine. These are not common deficiencies leading to neonatal seizure. Remember, if these deficiencies are asked, remember the question is about refractory neonatal seizure. It is about refractory neonatal seizure. They are all very rare only, but important from the exam point of view and the academic view. Okay, so what are you going to do in a baby who is having neonatal seizure but refractory to the usual treatment? The answer for this question straight away I will tell you, and then I will tell you the explanation. It is vitamin B6 or pyridoxine. Okay, that is the answer for this particular question. So how pyridoxine is implicated in the causation of neonatal seizure? Let us look at that. Okay, right. You all know that, okay, there are two things. One is GABA, second is glutamate. Okay, right. Basically, glutamate is a excitatory neurotransmitter. GABA is an inhibitory neurotransmitters. Okay, right. Now, what does this help? What is the conversion? Okay, what is the enzyme which helps in the conversion of glutamate to GABA? It is glutamic acid decarboxylase. Okay, right. And for this glutamic acid decarboxylase to function, this pyridoxine is very important. Okay, right. So basically, pyridoxine helps in the generation of inhibitory neurotransmitter GABA. Now, look at a condition when there is a pyridoxine deficiency. So when there is a pyridoxine deficiency, obviously this conversion will be impaired. So you will have deficiency of GABA or deficiency of inhibited neurotransmitter, and relatively you will have excess of glutamate or excess of excitatory neurotransmitter. This excess of excitatory neurotransmitter is what is going to result in case of seizures. That's all. Okay, so that is why for refractory neonatal seizure, it's a very standard thing that you have to give a shot of pyridoxine, okay, as a part of treatment. And hence the answer for this question is option A, which is pyridoxine. Now let us move on to the next question. This is the next question. All of the following are findings, PFT, pulmonary function test findings, in a child which is suggestive of asthma. Question is except, which is not suggestive of asthma as a question. Okay, right. Now this is also a very standard question which you may be reading even in your basic classes as well. Okay, right. So let us look at the options, okay, one by one. Okay, now the first option is increase in FEV1 to more than 15% after salbutamol inhalation. Salbutamol is a short-acting beta agonist. Now in case of asthma, it is one of the things which we do in the treatment. The patient comes with a asthmatic episode, okay, asthmatic attack. The first thing we are going to give is short-acting beta agonist. What will happen? There will be improvement. That's all. And if you want to put it in the form of pulmonary function test, there will be increase in the FEV1 to more than 15%. The criteria says more than 12% increase, but yes, 15% increase is also desirable. So hence it is a correct association with asthma, or it's a correct finding in asthma. That is correct. Let us look at the next option. FEV1 by FVC is less than 80%. That is also correct. Always remember, or less than 0.8. Okay. Asthma comes under obstructive lung diseases, and in case of obstructive lung disease, you all know that FEV1 bar FVC will be less than 80% or 0.8. That's also a correct association. Okay, right. Now, third is fall in FEV1 to more than 15% after exercise. Remember, an exertion or something like a severe exertion like exercise will always cause a reduction of FEV1. Okay, obviously it's an exertion. Okay, and this variety of exercise-induced bronchoconstriction is what we call it as a exercise-induced asthma. That's a variant of asthma. And in exercise-induced asthma, definitely after exercise there will be a fall in FEV1 to more than 15%, and that is also one of the criteria. That's a correct association. So obviously the answer for this question is going to be the last option, which is day and night variation of FEV1 more than 15%. Okay, according to the criteria, definitely there is a day and night variation in FEV1. But the point is, the day and night variation in FEV1 is not more than 15%, but it should be more than 20% according to the guidelines. And hence the answer for this question is option D, which is day and night variation of FEV1 then 15. It's not 15%, more than 20%. And hence the answer for this particular question. Now let's move on to the next question. The next question is about a 3-year-old toxic child presents with tachypnea, high-grade fever, and develop difficulty in swallowing with drooling of saliva within 4 to 6 hours of fever. Along with airway management, which of the following needs to be given? Now remember, this is a very classical presentation. I think you must be knowing what is the diagnosis in this particular question. Remember, a sick-looking child who is in the toddler age group. Okay, 1 to 3 years is toddler. Okay, child is having breathing difficulty, child is having high-grade fever. Okay, which tells you that this is a case of infection. Next is, child is also having difficulty in swallowing, which is dysphagia. Okay, along with the child is also having drooling of saliva, and all these within a short time of 4 to 6 hours. So this is a very severe infection. Remember, all these drooling of saliva, difficulty in swallowing tells you that there is an upper airway infection. Okay, upper airway infection. So what is this infection? Anybody ready with the diagnosis? I am sure that some of you might be already knowing the diagnosis. This is a typical case of acute epiglottitis. So the question basically is about what should be the management of acute epiglottitis. You all know that acute epiglottitis is a upper airway infection caused by a bacteria. The most common bacteria is Haemophilus influenza type B. Okay, right. Always remember, when the epiglottis is inflamed to such an extent, it can cause airway obstruction. So that is why already the question is given along with airway management. So airway management is already done. Now they are asking which other thing should also be additionally given. Remember, it's a bacteria. So what will be in the management? Yes, antibiotic should be added in the management. So the antibiotic of choice is third generation cephalosporin, and in this particular question the answer is option C, which is IV ceftriaxone, a typical third generation cephalosporin. Okay, and that should be given in the management. Now that brings us to the last question. The last question is, a child presents with swollen, red and tender knee joint 2 weeks following an episode of fever with bloody diarrhea. Okay, now see that fever with bloody diarrhea means that this is a case of dysentery. Okay, so following a dysentery, 2 weeks after that, the child is developing fever, not fever, but swollen, red, tender knee joint. Okay, what is it? It is nothing but arthritis. So an infection, following an infection, okay, there's a small lag period, there is a development of arthritis. So what is this arthritis called? Yes, this is called as reactive arthritis. This is called as reactive arthritis. It's a following an infection, okay, called as reactive arthritis. Commonly, this reactive arthritis is occurring following gastrointestinal and genitourinary infection. Commonly, okay, gastrointestinal, genitourinary infection. The common organism implicated would be Shigella, Salmonella. Okay, another group of organism which is also commonly implicated is Chlamydia. Okay, so for this particular question, which will be the answer? See the option. Rotavirus is the most common cause of diarrhea. It doesn't cause dysentery. Shigella will be the answer here. Correct. Answer is going to be Shigella. So the answer is, so this is a case of reactive arthritis, and the answer for this particular question is Shigella among the options which are provided. Right. In this small session, I'll be telling you about how to approach the pediatrics video in Marrow for your upcoming exams. We are almost halfway through this year, and some of you might have already completed all the pediatrics video and would have started the revision as well. And you might have given the subject-wise test also. So for those who have not yet started with the pediatrics, please watch all the videos completely. Each and every video is important, and it is according to the recent pattern of questions, and all the material which is covered are very, very important for your exams. So there is no skipping of any video as such as far as pediatrics part is concerned in Marrow. You should do it completely, and please try to make your own notes so that you are able to revise later also. Okay, right. Now the purpose of this video is mainly to give you an idea about the important topics which can be asked in the upcoming exams, or for any competitive exams for that matter. So when we talk about pediatrics as a specialty for the exams, okay, it is broadly divided into three categories: general pediatrics, newborn section and systemic pediatrics. Okay, when we talk about the weightage of the questions which come from these three sections, okay, it is almost an equal weightage, like 30 to 40% from general pediatrics, 30% of the questions from newborn, and 30 to 40% from systemic pediatrics. So what I am trying to tell you is that newborn may appear to be like a single chapter in your textbook, okay, but as far as the competitive exams are concerned, almost 3 out of 10 questions in pediatrics will be from newborn section itself. So it's a very, very important topic. Okay, right. Second part is regarding systemic pediatrics. You might have studied about some related topics in other subjects like medicine, surgery, pathology as well, as far as the systemic part is concerned. So it should be relatively easy, and so that's why I always ask the students to keep systemic pediatrics at the end so that they can just quickly go through those chapters. But general pediatrics and newborn are very, very important. You need to have a solid base before you can answer the question. So those two sections should be done first, then systemic pediatrics can be done. Right. So as I told you before, I am going to tell you about the important topics which you need to give importance first whenever you start your revisions. As far as general pediatrics is concerned, growth charts, okay, are very, very important. Okay, WHO growth chart is what we are following now. Interpretation of the growth chart is very, very important. Okay, with standard deviation, percentile, all those things are very important for your exams, and so many questions have been asked upon this. You may need to have a look at the normal values also, but what is more important is interpretation of the growth chart. Normal values, what I meant was values of height, weight, all those things, circumferences, all those things. Most important in the growth section is growth chart. And equally important is the growth disorder, okay, which includes the definitions of short stature, obesity, all those things, okay. The second thing I would want you to remember, okay, is developmental milestones, okay. Very thoroughly you should be remembering the developmental milestone very correctly, okay, because there are potential questions. Any exam you take, it is very important topic, okay, right. Then comes the chapter of nutrition, okay. In nutrition, two important sections, okay. Every year, every exam, one question is coming on SAM, which is severe acute malnutrition, and also we are expecting questions from two important nutrition disorders, namely rickets and scurvy. Those should be by heart, okay, very thorough, okay, it should be very thorough. Then comes marasmus and kwashiorkor, which is considered as forms of extreme malnutrition, which is very important. Any theory or competitive exam is concerned, it is very important. Okay, so once you're done with the growth, development and nutrition, then you switch over to pediatrics of, genetics part. Of course, you might have studied in your pathology as well, but what is important from the pediatric perspective is the clinical features of certain important genetic disorders, especially the trisomies, okay. All those Down syndrome, other trisomies are very important. And also the monosomy, Turner syndrome as well as Klinefelter syndrome, especially the clinical features are important if they want to ask a question in pediatrics about this genetic disorders, okay. That almost completes the general pediatrics part. Then we move on to the newborn section. As I told you before, newborn is a very important topic. Almost 30% of the questions in pediatrics will be from the newborn section, okay. So that means even though it's a single chapter, you need to give importance adequately like you give for other sections as well, okay. Starting with a normal newborn, like how is the baby taken care of at birth, including breastfeeding, all those things are very important, obviously, okay. And very important nowadays, for every competitive exam, we are getting one question at least from the section on neonatal resuscitation. Such an important that you should know it very thoroughly. It has been covered extensively in the video, and do go through it and revise it also properly. Next is, I told you, normal newborn, which includes actually the newborn care, okay, breastfeeding part, okay, as well as some common findings which you get in newborn, like common rashes you get in newborn, how to differentiate it from an abnormal rash. All those things would be part of this normal newborn, okay, right. Then comes the neonatal disorders as such, okay. There are so many neonatal disorders, but as far as your exams are concerned, four important things. One is sepsis, second is birth asphyxia and hypoxic ischemic encephalopathy. Next is the disorders causing respiratory distress, which include respiratory distress syndrome, meconium aspiration, all those things. Okay. Then of course very important is jaundice, because you know that jaundice is both normal as well as abnormal in newborn. So how to differentiate between this and different causes for pathological jaundice, all are going to be very important. Okay, right. And as a special mention, okay, in newborn there are certain scoring systems which are almost always asked in your competitive exams. Okay, like Apgar scoring, okay, Silverman scoring for respiratory distress, okay, and there is a staging system like the Sarnet and Sarnet staging system for HIE, and Bell staging for necrotizing enterocolitis. All are hot topics which are definitely expected in the coming exam. That also should be known. That completes the newborn part. Then we move on to the systemic pediatrics part. Now, systemic pediatrics part, remember, it's an overlap with your other subjects, especially pathology, medicine, and surgery. So it will be relatively easier. So I'm just going to tell you the important things, okay, which you need to revise, okay, before your final exams, okay. Right. One is congenital heart disease. Always remember, any congenital anomaly is given importance as far as systemic pediatrics is concerned, and undoubtedly congenital heart defect is number one topic in that. Okay, right. You should know the approach to congenital heart disease. What is cyanotic, what is acyanotic, and in the cyanotic variety, give so much of importance to tetralogy of Fallot, as well as how to differentiate it from other congenital disorders. Okay, other cyanotic congenital disorders. All those things are very important, extensively covered. Please go through that. It's a very potential topic. Okay, right. Next comes the common infections in the system, which includes the pneumonia, diarrhea, okay, urinary tract infection, as well as meningitis. All those things are very important. How to diagnose is one question. Second is the organism causing that infection, commonest cause of diarrhea. All these are very common questions, okay, which are expected in the exam. Okay, so do go through the entire video, make your own notes. Please keep revising it adequately. Okay, they are all very expected questions. Then of course I have mentioned, you can see that Kawasaki disease. Okay, Kawasaki disease is a vasculitis. Very special mention for that alone, because every year consistently for the last 2 to 3 years we are getting questions on Kawasaki disease, because the number of cases reported are increasing, and that's why the examiner want to test your knowledge about Kawasaki disease as well. Then comes the congenital anomalies. Okay, we need to know about Important congenital anomalies of the system, which include the neural tube defects, okay, GA system, which include the esophageal atresia, tracheoesophageal fistula, the hypertrophic pyloric stenosis, all those things, okay. Mainly these two things are very important for your exams, okay. And as far as the other disorders are concerned, in endocrine section, you need to go through congenital hypothyroidism and congenital adrenal hyperplasia. Two very hot topics in endocrine. If they want to ask a question in endocrine, it is most often, okay, limited to these two sections, okay, congenital hypothyroidism and congenital adrenal hyperplasia. To wrap it up, finally is a malignancy. You might have studied it very extensively in pathology. What I want you to remember in pediatrics is to know three things very importantly. One is ALL, second is neuroblastoma, third of course is not given, but it is Wilms tumor, okay. So these three things, okay, you need to be very sure about, okay, in your exams, okay. So that tells you about the important topics, okay, which you need to be very thorough, and these are topics which you need to study very carefully, okay, during your times of revisions, okay, right. So for those who have already prepared, this is a guide for you as to how to approach pediatrics in the next 6 months. And for those of you who are not yet started with the pediatric video, please see all the videos and make your own notes. That is going to be the most important part, okay. And I wish you all the best for the upcoming exams. Thank you.